Most of you have doubt regarding how to solve INICET questions, especially the multiple option correct questions, the sequence based questions, the match the following questions. So hello everyone, I am Dr. Mayukh Hazra. I am a third year resident of dermatology, and with my limited knowledge, I am going to solve INICET 2025 May questions. Last तक देखना because मजा बहुत आएगा. A man presents at PHC under Ayushman Arogya Mandir. See, Ayushman Arogya Mandir came in INICET May 2025, and the image of Ayushman Arogya Mandir was given in the NEET PG 2025. That means the topics of INICET are important for the NEET PG exam also. So even if you are a NEET PG aspirant, you must watch this video. With two successive BP readings, ideally you should take two successive BP readings 2 hours apart or at least 30 minutes apart to exclude the white coat hypertension. 140 by 94 first reading and 152 by 92 mmHg the second reading. What is the next best step in the management? So this is a clinical question. Ideally, I will say that if the patient is not comorbid, then we should wait for 3 months, advise him some lifestyle modifications. After that review, even if the BP is high, then we will have to give medication. If the BP is in the normal range, no need to give treatment. In the options we have admit the patient and start parenteral antihypertensives. तो चीटी मारने के लिए क्या बजूका यूज करोगे? नहीं ना. So this is wrong. Refer to district hospital. तो तुम किस लिए हो medical officer? This is also not correct. Start on amlodipine 5 mg once daily for 1 month and review. Yes, this could be done if the lifestyle modification is not given. Do nothing, wait until BP rises above 160 by 100 mmHg. This is also not correct. So this is the correct option, ruling out the options. So do subscribe to my channel because we are very soon to hit 40k subscribers, and all the important things for NEET PG, INICET and FMGE preparation you are going to get for free in this channel. Which of the following drugs can achieve complete clinical cure? Clinical cure is the key word. Radical cure is by primaquine, so this will be not the correct option. That is 3 and 4 is not the option, but the rest 3 are used in clinical cure. So 1, 2 and 3 will be the correct option. Marasmus is a form of severe malnutrition. Which of the following best characterizes metabolic status? In marasmus, the albumin level is maintained. That is why edema is not seen. Kwashiorkor is more severe because the edema is seen due to lack of albumin. So first option, increased insulin secretion with decreased fat breakdown. No, fat breakdown will increase. So this is not the correct option. Severe calorie deficiency while maintaining near normal serum protein. This could be the correct answer. But remember, in MCQ exam, you will have to choose the single best possible answer, not the only correct answer. So you must read all the 4 options thoroughly. Edema due to profound protein loss, no, it is seen in kwashiorkor. Positive nitrogen balance, no, there will be calorie deficiency. Negative nitrogen balance, that is option 2 is the correct option. Which of the following retinal detachment is most commonly associated with advanced diabetic retinopathy? So in diabetes, there is one thing called neovascularization. In new vascularization, new vessels are formed. They apply traction in the retinal epithelium and they pull it, causing retinal detachment. That is, they cause traction retinal detachment. Regmatrogenous is seen in retinal hole, fluid enters and retinal detachment happens. Exudative, if there is an exudative process that causes retinal detachment with accumulation of fluid. So this you can remember without memorizing. New vessels are forming in the retina, so they are applying traction. That is why tractional retinal detachment. Now I have INICET past 10 years previous year topic list. If you are short of time, you can revise this list in this last 5 to 6 days of preparation. Previous year it had a strike rate of 140 questions. The link is given in the description box below and pinned comment section. A 28-year-old male presents with urethral discharge, burning micturition. He reports unprotected sexual contact 1 week ago. Urine microscopy shows numerous pus cells. Culture reveals resistance to penicillin. And gram stain demonstrate intracellular negative gram negative diplococci, which is the best treatment. So this is a case of gonococcal urethritis. We know the best treatment is IM ceftriaxone. Even if in case of kits where you can't give the injection, you give cefexim 800 mg in the gray kit, that is the kit 1. So you need to give cephalosporins. Preferred is the ceftriaxone, the third line. A 38-year-old HIV patient with a low CD4 count with ondinophagia, retrosternal pain. On GI endoscopy, white plaques are seen on esophageal mucosa. White कौन सा organism कराता है? It is Candida. Oral thrush, white. Candidal intertrigo in the fingers, it is white. Candidal intertrigo in the groin region, it is white. Candidal vulvovaginitis, it is white. So everything that Candida causes is white in color. So this is a case of candidiasis. In candidiasis, what you can see is yeast and pseudo yeast germ tube formation, which is called Reynolds broad phenomena. This all integration you need to do to have complete hold over the topic. So amastigot within macrophages, no, this is telling about leishmaniasis. Yeast and pseudohyphae, this is correct, not a squamous cell cancer, and this is also not the correct option. Coming to the next question, 6-week old infant. This is an interesting question. With common sense and your clinical acumen, you can rule out the options. He has non-bilious vomiting immediately after feeding. So after feeding, he is having vomiting, maybe a case of pyloric stenosis, and it is non-bilious, so not distal to the pancreas because it is a non-bilious vomiting. The vomiting is forceful but non-projectile, so ruled out. Pyloric stenosis, it is projectile. Bowel movements are normal, so pyloric stenosis ruled out. And abdominal examination shows no significant findings, so it is not a case of obstruction. What is the likely diagnosis? GERD can be because after feeding only the child is vomiting. Intestinal obstruction, no, because it is not projectile vomiting, it is non-bilious, and the abdominal finding peristaltic sounds are normal. Pyloric stenosis, no, because in pyloric stenosis you see a olive mass and a projectile vomiting. Cow milk allergy, you will mainly see diarrhea, not vomiting. Vomiting might be present, but main feature is diarrhea. So this is a case of GERD in the infant. This question you can apply common sense. Tight junction which form a selective barrier regulating the paracellular transport in epithelium are located in which specific location? Let me draw you GIT epithelia which has columnar epithelia and which has tight junction. Because in GIT you know much of fluid is there. If the fluid enters, it can cause mayhem. So will it be basal side? No, there are hemidesmosomes. और बेसल साइड में होने से फ़ायदा क्या? क्योंकि यहाँ से तो पानी घुस जाएगा. इज़ इट एपिकल साइड? एपिकल साइड में किससे बाइंड करेगा भाई? एपिकल साइड में तो कुछ है ही नहीं. So not apical side. Now basolateral or apicolateral. See, if it is basolateral, till here water can enter and it could cause separation of the cells. It could damage the cells also, and it can cause apoptosis or necrosis of the cell. So it will be located apicolaterally so that water cannot enter at all and cause cell separation. Thus the answer is apicolateral. Apply your common sense, draw diagrams in your mind, you are going to get the correct answer. See, INICET is not about tough questions, informative based question. I am not in culture for 4 years. I am applying common sense and I can solve some questions. So you can also solve some questions even if you don't have that much knowledge. Apply your common sense. Image based question. In image based question, action of muscle, origin, you take a string and attach to the attachment. Now you pull the string. Here I am pulling the string, so the direction, this will rotate and the mandible will open. So this muscle, that is the medial pterygoid, is causing depression. Just draw the string diagram and you will be able to know the action of muscle even if you don't remember the action of muscle. Match the following classes of toxic agents. So we are seeing the match the following questions also. Depressant, opioid. So 1D, because opioids are depressant, it is CNS depressant also and respiratory system depressant also, because it is regulated by the medulla oblongata. So in case of head trauma accident, never ever give opioids. This is also previous year question. Organic irritants is croton, 2B. Metallic irritant, lead is a metal, you know, 3B. And deliriant is cocaine, 4C. That is 1D, 2A, 3B. That is the option 1 is the correct option. Match the schedules of drugs in correct sequence. First is morphine. Morphine is a illegal drug in India, and illegal things start with X. You know the website also. So morphine is schedule X. I know. Now coming to schedule H, whether it is insulin or hepatitis B, I don't know. So there could be 2D or there could be 3D. Let's see which option has 1C. So option 1 and option 3 has 1C. Now option 1 has 2A and 3 has B. No D option is present in 2 and 3. Option 3 has 2B and 3D. That means this is the correct answer. Option 3 is the correct answer. With knowing only one schedule, I ruled out all the options because I don't have memory. This is a previous year topic, but I have forgotten. But with my limited knowledge also, I could mark the correct answer. So you can also mark it. During a pap smear procedure, what is the correct sequence of steps to be followed? Scraping the cell with IR spatula, per speculum examination, lithotomy position, PV examination. First will be lithotomy position. बिकॉज ऐसे ही तुम जाके कस को घुसा दोगे तो तुम पे तो रेप केस लग जाएगा ना. First thing is the basic lithotomy position. Only one option is having that. That is 4 is the correct option. After that, you do per speculum examination and you with the IR spatulas take the cervical cells. After that, you do PV examination, not before that, because if you do PV examination, some of the cervical cells can be dislodged and you can get a false negative result while you are scraping with the IR spatula. Which of the following statements are correct? Again, multiple option correct question regarding snake envenomation. Elapide venom is neurotoxic, not myotoxic. So this is wrong. Viperidae venom, V for V, vasculotoxic, correct. Hyaluronidase is secreted by all snake venoms. I am not sure. This is a question mark. Snake toxin spreads mainly through lymphatics and superficial veins. Yes, that's why you shouldn't do occlusion in the arm. So I am confused between 2 and 4 and 2, 3 and 4. When you are confused between two options, even if it is NEET PG or INICET, you must mark the answer because 50% chances you are going to get it correct. Now, according to my understanding, I think hyaluronidase is present in all snake venoms because we see the whole blood clotting test. I may be wrong because I am not attached to PG preparation for 4 years. You do check your app what is the answer. So I am going to mark that all snake venoms have hyaluronidase because in whole blood clotting test all the snake venoms are positive. So I am marking this. But do check it, and if there is any mistake, do let me know in the comment section below. एंड मज़ा आ रहा है कि नहीं, कैसा लगा, वो वाला रिव्यू भी कमेंट सेक्शन में दे देना. इट रियली हेल्प्स मी टू इम्प्रूव अ लॉट. Which of the following statement about skin and its layer is correct? Finally a dermat question. I am happy now. Epidermis is derived from ectoderm. Again, multiple option correct question. Yes. Hypodermis is derived from endoderm. No, it is derived from mesoderm. Stratum corneum is the outermost layer. Yes. Cellular layer, no, it is acellular layer. If it is cellular, it is a pathological finding that is called parakeratosis. So this is wrong. The epidermis regenerates from deeper follicular cells of hair follicles and sebaceous glands. Yes, the bulge area helps in regeneration of epidermis, and the sebaceous glands also has some stem cell which help in the regermination of epidermis, which you see after healing of 10 patients. Perifollicular skin comes first, that is from the hair follicular stem cells the epidermis generates. So 1 and 4 is the correct answer. Which type of anemia is most likely to respond to erythropoietin therapy? Nutritional anemia? No. Iron therapy is going to help you in this. CKD, the production of EPO is reduced, so it is going to help in the CKD. Anemia due to myelofibrotic disorder? I don't think so. You should counteract the fibrosis by anti-cancer agent. Aplastic anemia, the synthesis of RBC is impaired. Even if you give EPO, it is not going to help. So according to me, only 2 is the correct option. You can have other views that anemia can have role in myelofibrotic disorder. EPO may have role in myelofibrotic disorder. So do check it with your apps. I am not the most knowledgeable person in this aspect. Blotting technique. So this has a mnemonic I am going to show you. The food pattern. North, they eat roti. So northern blotting, RNA. South, they eat idli, dosa, sambar, chutney. So dosa. Southern blotting, DNA. And west, in the Mumbai, they eat pav bhaji. So pav for protein. Let's see northern blotting DNA. Yes, it is. Southern blotting RNA. No, this is not. Northern blotting RNA, yes. Southern blotting protein, no. Northern blotting protein, no. Northern blotting RNA, southern blotting DNA, western blotting pav bhaji, yes. This is the correct option. Now the last question is for you all guys. You see the question. According to MTP Act in India, what is the minimum legal age of consent required for undergoing MTP without parental or guardian approval? You answer me in the comment section below. I will try to give hard reacts those who answer correctly. But a recent Supreme Court judgment has also come that even if minor, the nothing in the world can stop the girl from undergoing MTP if she desires. So I hope the video was helpful. Do subscribe to my channel. We are very soon to hit 40k subscribers. Now you can see how is NEET PG different from INICET and what is the last 10 days strategy for INICET. All the best. See you soon.